Thanks very much. I appreciate the opportunity to speak to you all, and I think I certainly welcome your interest in behavioral health. This is an enormous area of unmet need. There's a shortage of mental health professionals, even in the most highly developed countries. And if we look at many other countries around the world, the shortage of mental health professionals is absolutely staggering. So I think you're aware that almost every family is touched by a mental illness or an addictive disorder. So these are among the most common illnesses that we see in healthcare in general. And in fact, when we look at the top 10 causes of disability worldwide, several psychiatric disorders are ranked in the top 10, along with heart disease and cancer. One of our biggest challenges, however, is that the average person is not really aware of what mental illness is. And even disorders like depression and anxiety are often confused with everyday problems. And when we get to a disorder like schizophrenia, there's often a complete misunderstanding and assumption that this is a multiple personality disorders or what have you. So mental health literacy is an enormous challenge, and the hope is that we can take advantage of a variety of technologies to help us address that need. And even when people do become aware of some mental illness signs or symptoms, it is very difficult for them to transition into care. Many people take surveys. For example, Mental Health America has a number of online surveys to help people identify whether they're suffering from an anxiety disorder or depression or what have you. And most of the people who take those surveys and score positive do not seek treatment. And so we're again hoping that we can use digital technology to help us access such people and enhance their ability to access appropriate care. As a result of all of this, when we look at the duration of untreated illness, it is enormous. So someone with a bipolar disorder or depression will often go for years without a diagnosis and without any appropriate treatment. Even in its disorder as severe as schizophrenia, in the United States, the median duration of untreated illness is a year and a half. So imagine what it's like in many other countries around the world. We also can use, I think, technology to enhance sustained engagement, because when we have a shortage of mental health professionals, it is difficult sometimes to get an appointment. When people do begin treatment, they often drop out prematurely. We also have an opportunity to integrate with general medicine. So many people are more likely to see their primary healthcare provider than any other person in the healthcare community. And we rely very heavily on those individuals to also help us screen for mental illnesses. And there's tremendous interaction between mental illness and medical conditions in terms of influencing outcome, et cetera. We can use technologies, smartphones, wearable devices, sensors, to help us identify people who are struggling with mental illness. And as I will talk about in a moment, we can use those tools to also help monitor treatment. So some examples, we've used social media postings, natural language processing to try to identify early signs of mental illness among youth. We've also been able to analyze internet search histories. The amazing phenomena now that we can almost see what people are thinking based on what they're searching for on the internet. And using those strategies, we've been able to identify early signs of psychosis in particular, but the same thing can be applied to anxiety and mood disorders. And then the question becomes, how can we reach people in a way to successfully engage them in treatment? We're also using voice and speech analysis, and these are things that can be obtained very readily, even remotely, to help us characterize people's mental state and perhaps even help in the context of differential diagnosis. Digital phenotyping, remote monitoring. So we've done studies, for example, with smartphones where we can try to establish anomaly detection. And by that, I mean, if someone is not sleeping or there's a change in their pattern of sleep, that gives us a clue as there's a possible change in their mental health status. We can use technology to ensure adherence, as I mentioned, facilitate sustained engagement, and very importantly, to increase the efficiency of providers. We know we have a shortage of mental health providers, even in a country like the US. And if we can do anything to increase their efficiency by providing the technology to give them needed information in a real-time basis, we can make their interaction with patients much more efficient. We can help them monitor patients even when patients are seen at infrequent intervals. We can also engage families and significant others in working with us in a variety of treatment strategies. And this becomes particularly important with children and adolescents, where often the more severe mental illnesses are already apparent, and parents are often at a loss to know what to do and to how to successfully help their child receive appropriate treatment and stay in treatment, et cetera, et cetera. So in a healthcare system that is very complicated, unfortunately, mental illnesses and addictive disorders often go unrecognized and untreated. And even when they are recognized, we don't have enough resources to engage them the way they need to be engaged. And it's a tremendous opportunity for technology to enhance access, facilitate cost-effective treatment, and ultimately improve outcomes and save enormous sums of money when we talk about the direct costs of care and the indirect costs associated with mental illness, the loss of functioning and long-term disability. So we're very excited at the opportunity for many of you folks to engage in these challenges and believe that you have a lot to offer. So thank you.